Hey, everyone. Welcome back to the channel. In today's video, we're diving into a topic that's incredibly important for women's health but often gets overlooked: pelvic floor health. Whether you're pregnant, postpartum, or just going through life, pelvic floor health affects so many aspects of our well-being. So, in today's video, we're going to break down what your pelvic floor is, why it's essential, and how to keep it strong and healthy. Let's get started. First things first, what exactly is the pelvic floor? Think of it as a group of muscles and tissues that form a hammock at the bottom of your pelvis. These muscles support your bladder, bowels, and uterus. It's not just about holding things up. Your pelvic floor plays a key role in urinary control, sexual health, and core stability. When your pelvic floor muscles are strong and functioning well, everything works as it should. But when they're weak or stressed, it can lead to a range of health problems. Now, why does pelvic floor health matter so much? A healthy pelvic floor helps you maintain control over your bladder and bowels, which, let's be honest, is pretty important. It also impacts sexual pleasure and can even help reduce lower back pain by stabilizing the pelvis. But when the pelvic floor becomes weak or overactive, it can cause a whole host of issues. 1. Incontinence. This can include leaking urine when you laugh, sneeze, or exercise. 2. Pelvic organ prolapse. This is when the bladder, uterus, or rectum slips down into the vagina due to a weakened pelvic floor. 3. Painful intercourse. A weakened pelvic floor can cause discomfort or pain during sex. 4. Chronic lower back or pelvic pain. This often happens because the pelvic floor muscles support your spine and organs. Anyone can experience pelvic floor issues, but certain groups of women are at higher risk. 1. Pregnancy and childbirth. The pelvic floor undergoes a lot of strain during pregnancy and childbirth. 1. Vaginal delivery, in particular, can stretch or damage the pelvic muscles. 2. Aging. As we get older, especially after menopause, the pelvic floor muscles can naturally weaken due to lower estrogen levels. 3. Obesity. Extra weight puts added pressure on the pelvic floor muscles, leading to weakening over time. 4. Chronic coughing or constipation. If you deal with chronic coughing or constipation, this constant pressure can strain the pelvic floor. But here's the good news: you can do something about it. Let's talk about how to keep your pelvic floor in great shape. Here are a few tips to strengthen and support those muscles. 1. Kegel exercises. You've probably heard of them. 1. To do a Kegel, simply contract your pelvic muscles as if you're trying to stop the flow of urine. 1. Hold for 3-5 seconds, then release. 1. Do this 10-15 times, a few times a day. 1. Kegels strengthen the pelvic floor and can prevent or improve incontinence. 2. Pelvic tilts. Lie on your back with your knees bent, feet flat. 2. Tighten your core and tilt your pelvis upward, holding for a few seconds before relaxing. 2. This exercise strengthens the pelvic floor and lower back muscles. 3. Squats. Yep, good old squats. 3. They not only target your legs but also help strengthen the pelvic floor muscles. 3. Keep your feet shoulder width apart and squat down as if sitting in a chair. 3. Make sure to keep your back straight and avoid letting your knees extend past your toes. 4. Posture. Good posture supports your pelvic floor. 4. Make sure you're sitting and standing with your pelvis tucked under and your spine aligned. 4. Slouching can put unnecessary pressure on your pelvic muscles. 5. Mind your weight. Maintaining a healthy weight helps reduce the strain on your pelvic muscles. 5. If you're struggling with weight, talk to your healthcare provider about a sustainable plan to lose or maintain weight. So, how do you know if your pelvic floor needs attention? Here are some red flags. 1. Leaking urine when coughing, sneezing, or exercising. 2. Difficulty holding in bowel movements. 3. Pelvic pain or heaviness. 4. Pain during intercourse. 5. Frequent urinary tract infections, UTIs. If you're experiencing any of these symptoms, it's a good idea to talk to your healthcare provider. They can assess your pelvic floor health and suggest appropriate treatments or exercises. Lastly, if your pelvic floor issues are severe, persistent, or affecting your quality of life, it's important to seek professional help. A pelvic floor physical therapist can guide you through specialized exercises, and in some cases, other treatments or surgeries might be necessary. To wrap up, pelvic floor health is a key aspect of overall wellness for women. By taking care of your pelvic floor through exercises, good posture, and a healthy lifestyle, you can reduce the risk of many common issues and improve your quality of life. If you found this video helpful, be sure to like, share, and subscribe for more health tips. And leave a comment below. Let me know what topics you'd like to hear more about or if you have any questions. Thanks for watching and take care of your body.